Hello everybody, today we're going to be talking about the diagnosis of ischemia and the setting of left bundle branch blocks. Now it can be difficult to diagnose ischemia and the setting of left bundle branch blocks, and it is often said that left bundle branch blocks can mimic, conceal, or be caused by ischemia. Now whether you're trying to diagnose acute coronary syndrome or you're performing exercise stress testing for diagnosis of stable angina, it can be difficult to diagnose ischemia. Now this is usually because of ST segment and T-wave abnormalities that are part of the changes that occur in the setting of left bundle branch blocks. Now, because of that, they developed criteria for the diagnosis of ischemia in this setting. These are the Scarboza criteria, the Smith criteria, or the Barcelona criteria. Recall that in left bundle branch blocks, you can develop ST segment and T-wave changes. Now, this is usually discordant changes, meaning that they are in the opposite direction of the QRS complex. For example, if you have a positive QRS complex, you have ST depressions and T-wave inversions, and if you have a negative QRS complex, you're going to have ST elevations and T-waves that are upright. Now, this is usually a part of a left bundle branch block, and these are considered to be normal changes. And I'll talk more about this in more details in the video I made about the diagnosis of left bundle branch blocks and the ECG. Now, the first criteria that they developed are the Scarboza's criteria. They developed this over 20 years ago, and these are weighted criteria, meaning you have a scoring system. And you need to collect 3 or more points in order to establish the criteria, and you can say that there is ischemia going on within the appropriate clinical setting, of course. Now, because discordant changes are the usual findings in setting of left bundle branch blocks, this criteria considers concordant ST changes to be abnormal. So if you have a concordant ST elevation in any lead that is more than 1 millimeter, you get 5 points, so you can basically diagnose ischemia using only the first criteria. This is demonstrated right here. You have a positive QRS complex and have ST elevation and T-waves that are upright. They also consider concordant ST depressions in leads V1 to V3 to be also abnormal. Demonstrated right here is a negative QRS complex with ST depression. Please make sure that it's not all the leads, it's only leads V1 to V3, and this gives you 3 points. So again, you can also diagnose ischemia using this point alone. Now, because discordant ST elevations can be seen, they consider it to be abnormal if it is more than 5 millimeters. And this gives you only 2 points, so you can't really diagnose based on this criterion alone. And if you get 3 or more points, you can say that there is ischemia going on. The Scarboza criteria are highly specific for MI. The specificity is around about 96%. So its presence means that it's very likely to be ischemia. However, its sensitivity is not that good. It's about close to 36%. So it's going to be missing a lot of cases, and the absence of Scarboza criteria is not really reassuring. Now, because of these limitations, they developed new criteria. Those are the modified Scarboza criteria or the Smith criteria. The difference is that these criteria are not weighted, meaning they don't have a scoring system, and the presence of any of the criterion can establish the diagnosis. The first 2 criteria are the same, and only the third criterion is different. And it's because they think that the ST elevations that are discordant are relative to the S wave. So if you have a small S wave, you're going to have a small ST elevation, and if you have a large S wave, you're going to have a large ST elevation. So you shouldn't have an absolute number. So the size of ST elevation can change depending on the size of the S wave. So having an absolute number like 5 millimeters shouldn't be very reliable, as you can still have ischemia even if the ST segments are elevated less than 5 millimeters. So they say that if the ST segment elevation is more than 25% of the depth of the preceding S wave, that this is also considered to be abnormal. Again, these criteria are unweighted, so there is no scoring system. The specificity is about 99%, so that's very specific, and the presence means that it's very likely to be MI. Now, because of the change in the third criterion, the sensitivity is actually increased, and it's about close to 80%. However, it can still miss cases. The sensitivity is pretty good, however, it's not close to 100. So they also developed a new criteria called the Barcelona criteria. Again, these criteria are also unweighted, so there is no scoring system. And the first point is the same for all the criteria that we talked about. But the second one is different because it's not only limited to leads V1 to V3. Concordant ST depression is considered to be abnormal in any lead, as long as it's more than 1 millimeter. And the third criterion is discordant ST deviation, whether that be elevation or depression, in any lead if the R waves or the S waves are less than 6 millimeters. So basically you're looking for low voltage leads, and if the R and the S waves are less than 6 millimeters and there's discordant ST deviation, this can be considered also abnormal. Again, these are unweighted, there's no scoring system, specificity is about 94%, and because we're including more leads and becoming more generalized, we've increased the sensitivity close to 93%. It's currently the most sensitive criteria available. However, this criteria has only been internally validated, so the studies that have been done on this criteria have only been done at the institution it has been made. However, there are no studies that further evaluate this in other places. Now let's take a look at this ECG. Now you can say this is a left bundle branch block because of the wide QRS complex, the wide and slurred R waves in lead V6, the absence of Q waves in the lateral leads, and the R peak time is also prolonged. Now you can see a lot of discordant changes, however they're all less than 5 millimeters, so we cannot apply the third criterion of Scarbosa's criteria. However, in lead AVL, you can notice that the QRS complex is upright and it is accompanied by ST elevation. So this is concordant ST elevation in lead AVL, and the appropriate clinical circumstances. This is positive for the first point in Scarbosa criteria, in which you have concordant ST elevations, and you can say that this is likely an MI. If you look at this ECG with left bundle branch block, we do have discordant ST elevations, but because these ST elevations are less than 5 millimeters, you cannot apply the Scarbosa criteria. But on lead V3, the depth of the S wave is about 10 small squares. That would be 10 millimeters. 25% of that is 2.5 millimeters. And if you look at the S elevations, they're about 3 millimeters. So this basically establishes the third point in the Smith criteria, and then you can diagnose a STEMI. In this ECG, we don't have any concordant ST elevations, so the first point cannot be applied. However, if you look closely, you can notice that we have concordant ST depressions in lead V5. Now, since this is in lead V5, you cannot apply the Scarbosa criteria because it says that concordant ST depressions can only be seen in lead V1 to V3. However, the Barcelona criteria says that ST depressions that are concordant can be found in any lead. So in the appropriate clinical circumstances, this will establish the Barcelona criteria and you can diagnose ischemia. And that is how you diagnose ischemia in the setting of left bundle branch blocks. And thanks for watching.